Hello, I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and we have a wonderful show for you today. But before we get to the main topic, I want to talk about caring and sharing. I want you to care about yourself so that you can take good medical care and take your medicine, go to your doctor, and when you feel that you're healthy and doing well, I want you to tell others how you're doing it so we all as a community can do better as far as healthcare is concerned. We should all be better healthcare consumers, and that way we do it as a family. If you're the wife of the family, pull your husband into the doctor, make him go see the doctor. He has, that secret pain that he doesn't want to tell anybody about. And I call those secret pains med moments. You can't ignore them. A moment when maybe your blood pressure's high and you woke up that morning with a headache, or when you walk upstairs, you get some chest pain. That's your body telling you that something just may be wrong. That's a med moment, and that's the time that you should go see your physician. Don't be ashamed, don't be afraid, go see the doctor. All right, guys. Our social media, we're doing a lot on social media. Contact us, Obey Your Doctor, all righty? It's Facebook, Instagram, we have Twitter. Just Obey Your Doctor. Come on, we're doing a lot on there. We're doing weight loss, we're doing inspirational messages, we're putting health tips on there. Go check us out, all right? And you can email us at obeyyourdoctor.com, all righty? Let's talk. I want to talk about high cholesterol. And high cholesterol equals, it's a big word, hyperlipidemia, all righty? And that's when you have too much fat in your bloodstream. And when those little fat globules are floating around in your bloodstream, they clog up your blood vessels. And when they clog up your blood vessels, that means that you can have heart disease, you can have, something we call peripheral vascular disease. We can have many types of disease that the blood can't get to certain tissues. And if the blood can't get there, that means oxygen can't get there. That means we have a serious problem. So we want to keep that fat down. And how do we lower our cholesterol? Well, there are several ways that we can do this. We can change the way we eat, which is the primary way that I like to put forth, okay? Number one, if you go into your doctor, ask him to see if you could see a dietitian. A dietitian can kind of structure things and your foods so that you're eating less fats and less grease. Eat foods that are low, as I said, fat and grease, low in fat and grease, okay? 5 servings of fruit and vegetables a day. Hey, minerals, you got all your vitamins, you got so much water in the vegetables and all. It's great. These are the type of calories that are healthy calories. That's what we want to eat. More fruit and vegetables and whole grains and less red meat. That's the secret. Now, know your numbers. Okay. How much weight should you carry? Depending on your height and your body type. There's something called the ideal body weight. You can go on the computer, go on Google it up. Ideal body weight, you put your numbers in there and you can find out how much weight you should carry for your size. How much weight do you have? And then, if you're 200 pounds and you should be 180 pounds, then you got 20 pounds to lose. What is your cholesterol? Well, listen, when your doctor takes your cholesterol, what you want to be is less than 200. If you're less than 200, you're in a pretty good range, and that's where you want to stay. Alrighty. And there's something called HDL, and HDL is supposed to be the good cholesterol, and you want that to be above 60, and that's protective. That helps protect you from heart disease. Well, what can we do? Number one, exercise. every day. Do a walk, get out and walk about 30 minutes a day. Hey, that works. Believe me. Decrease your weight. Keep your weight under control. And don't smoke. Smoking is bad. Clogs up the arteries. It really does. So throw away the cigarettes. Okay. And your doctor, go to your doctor, get a simple blood test. It'll tell you exactly what your cholesterol is. All right. That's cholesterol. Well, let's get to the main topic tonight. Back pain. We're going to talk about that back pain. Everybody's had it. I know several times in my life I've been doing just a little something and all of a sudden it's hit me. And boy, do we have pain. And another thing called sciatica. We're going to talk about that as well. These two particular topics, I have the perfect person here today to talk to us about these. And his name is Dr. Lawrence Daniels. And let me give you his title. He's a neurosurgeon. I mean, hey, I'm impressed. Neurosurgeon. And he's director of New Neurons Neurosurgical Institute. Dr. Daniels, welcome to our show.
Thank you, and it's a pleasure.
All right, so this is the first time you're on the show, but neurosurgery, I know we're going to have you back. I'm just going to tell you straight out, you're coming back.
Anytime
you're coming back.
You need me, it's fine.
All righty. So what I want to do, and we're going to talk about back pain, and we're going to talk about sciatica, and you're going to tell me what sciatica is, because that's a big word, and I have no idea what you're talking about.
All right.
But the thing of it is, what I want you to just, since neurosurgery, tell me about yourself, man. Tell me about neurosurgery. What is this specialty?
All right, well, I'm a neurosurgeon, which means I went to medical school to become a medical doctor. Mm-hmm. And then I spent at least 7 years after medical school in a residency. It's one of the longest residencies we have. And in that residency, we're trained to do surgery on and treat diseases of the central nervous system and the peripheral nervous system. Central nervous system being the brain and the spinal cord, and peripheral being the nerves that come out for the brain and the spinal cord. So oftentimes, people in the community think of spine surgeons as orthopedic surgeons because they think of the spine as the bone, right? But that bone is really just there to protect the nerves in the spinal cord. So orthopedic surgeons and neurosurgeons both operate on the spine, but neurosurgeons are trained to dig deeper into the anatomy of the spine, into the nerves, into the spinal cord themselves. And so oftentimes when people have back problems, the back problems are being generated from either the bones or the joints or the nerves or the spinal cord that's in the back region. And so neurosurgeons are surgeons that treat patients for those diseases and those problems.
Okay, let's step back just for a minute, all right? Because you said that was a mouthful. I'm going to tell you. Let's just step back for a minute. The brain actually, there is the brain in the skull. Mm-hmm. And then there's a spinal column that comes down from the brain.
Yeah.
That spinal column is in the middle of the spine. Am I right there?
So yeah. So what happens is that in order for us, so the spinal cord and the brain are very important to us.
Very important.
And they're responsible for, our abilities to get up and provide for ourselves and eat.
Right.
And so nature has given us a means of protecting that very important part of our body, and it does so with a bony skeleton, right? So you have the skull that protects your brain. Right. And then you have a continuation of that bony construct down into your spine. And that's the vertebral column, which is made of very large bones in front that really bears the weight of our body. Right. And then a ring of bone behind us. And inside that ring is the spinal cord and the nerves. And eventually, when you get far enough low, the nerves exit out. That you can look at it like a cage. That cage to protect the spinal cord and the nerves.
Right.
It exits out and then it goes into our muscles and our legs and our skin. And so oftentimes we can get weakness if those nerves are being injured while they're trying to exit the spinal cord, or we can get pain.
Okay, so let me just go back through that again, because this is so important, because no one's ever approached this subject before on the show, and I just want to make sure. We have the brain, we have the spinal cord that comes down. The bone surrounds the spinal cord, which is the spine, as it comes down. As it comes down, there are different nerves that come out of the spinal cord, coming out of that bone, that goes to the muscles and the ligaments and everything, and allows us to move. And that's how the brain tells my finger to move. because it had moved, it went down the spinal cord, out through the nerve, and the finger got the information, and then I did this.
Exactly. So two things.
Excellent.
So one, the brain is like a command center.
Right.
And then the spinal cord and the nerves are like telephone poles going out into the community. And if you wanted to send an emergency alert to every house in Newark, you would start that signal in the command center, and then it would take that signal would travel onto the phone poles and go to each of these different homes.
Excellent.
But there's one other thing that happens. So that's how we control movement. But then what about receiving information?
Oh, all right.
And this is important because it sets us up to deal with something like sciatica or pain that we experience in our leg, but it's not that we're injured in our leg, but the injury occurs in and around the spinal column where the nerves exit out the spinal cord. We perceive it as being pain in our legs or in our extremities, but really the injury is in the area in the back, right? And it's just that those signals that eventually go to the brain from the leg have to pass that area of the back, so that it's like tricking the brain, right? But it's important for a physician and it's important for patients because it'll give you an idea of where your pathology is, where your injury is, where it's located, and whether it's and what type of treatments will help it out. And we'll talk about that. Interesting.
So you kind of. Okay, so we're going to step back because I know we went further than I wanted to initially because we just got talking.
My nephews tell me I'm pretty verbose, but this is
great.
This is neurosurgery, right? Everyone talks about, oh, you're not a brain surgeon. Well, this is neurosurgery, so it's complicated. But I want to go through it in a way that I have to go through it with my patients in the office, because they have to understand what's going on with their body in order to give me permission to intervene.
Right.
So that's what we'll do here. So it's fine.
Now, just give me an understanding of some of the back pain. We'll start with back pain and then we'll go into sciatica. Just give me some understanding of what causes back pain and why it comes about.
Okay. So there are different things that can cause back pain. And I guess the most broad way to discuss it is what causes pain. Right. What is pain? How do we perceive pain? Well, we have pain receptors in our body that are attached to nerves that then send signals to our brain. And pain is very helpful because pain is going to let us know whether we have our hand on the stove or not, and whether we need to move our hand to prevent it from being damaged further. Or pain is going to allow us to pay attention to a part of our body that might be injured, that we need to take care of. You mentioned earlier, you might have that pain that you're not letting anyone know about, but that pain is your body's way of telling you something's not right.
Something's not right.
And something needs to be taken care of.
Right.
So we have these pain receptors all over our body, and we have these pain receptors in our back. And there are certain things that can trigger and activate these pain receptors in our back, like anywhere else in the body. So if you get an injury to muscle or skin or other connective tissue like ligaments or even the bone, right? You get it, like a common injury you get into the bone is a bone fracture. Those injuries will alert the receptors in the body that something is awry, and your body will interpret it as pain. So sometimes we get back pain because we injure. We are either so we talked about muscle. You'll tear your muscle, right? And if you tear your muscle, you'll get pain in that area of your back, or you can get a cut on your skin, right? Or you can get an infection on your skin, or what most commonly happens to someone is when they're having back pain, it's associated with degeneration, wear and tear.
Wear and tear, degeneration. Okay. So were you talking about arthritis, or are you talking about like, you tell me. I know there's this big word osteoporosis with females, but you go into that.
So it's the type of arthritis that all of us get, right? It's called osteoarthritis. And what it is degeneration in and around the bones and the joints. And so essentially, when we're young, our bodies are relatively young, and so we've been doing things to use our body for a relatively short period of time. That's why younger people don't really have these aches and pains. And it's only as we get older, 30 is that year for me, right? First time I threw my back out. As we get older, then we start noticing aches and pains that we didn't notice before.
Right.
But the problem is the same bones and joints in your vertebral column, you've been using it for 30 years now.
Right.
And that use over time begins to wear on the different parts, and those different parts begin to degenerate, right? Deteriorate somewhat. And that's what gives us some of our pain. And the overwhelming majority of back pain that individuals experience is a result of that wear and tear, that osteoarthritis.
Okay. Now, tell me about the muscle spasm. I know I've thrown, and I'm so most adults, if you're my age, you've thrown your back out a couple times. I mean, one time I was just out